Hi everyone, welcome to the virtual open day at Salford. My name's Evie Prescott, one of the lecturers on the sport rehabilitation course. I've just thought with this presentation I would aim to introduce you to one of the key themes throughout the course, which is biomechanics. Okay, so what do we mean by the term biomechanics? Well, essentially, bio just means body and mechanics means movement. So we might require knowledge about movement of the body to help us diagnose and treat injuries. And a sports injury is defined as disruption or failure of biomechanical tissue in response to sporting endeavours. And by biomechanical tissue, all we mean by that is the different tissues within the body, such as cartilage, muscle, tendon, and things like that. So most of these sports injuries are caused through mechanical processes or events. And we need to understand why and how these tissues fail in order to effectively rehab them and prevent future injury. So if you look at the picture on the right, most of you, I would imagine, would be able to spot which of those pictures the person is more likely to injure their medial knee, and by medial I mean the inside part of the knee. Just by looking at the movement strategy there, you can start to get a clue that the picture on the right is loading the medial knee, the inside of the knee, a lot more than the one on the left. So if this person came into your clinic and they were complaining of medial knee pain on the inside of the knee, then it might give us an indication that it's actually their movement strategy that's perhaps caused that pain. So we might need to do something about the way that they move in order for this injury not to occur again. However, as sport rehabilitators, we're not just interested in injuries alone, we're actually interested in getting people back to performance. So not just getting them back to activities of daily living, but back to peak performance and, if possible, even better than they were before. So we can also use biomechanics to actually get information on how somebody is performing. So we might not just analyse movement technique to look for injury risk, we might look to see, well actually, they're leaking a bit of energy by doing things that way, so maybe we could modify the technique in a certain way to enhance performance, enhance power output and things like that. We can also analyse the effects of different equipment on the body as well to enhance performance, and you can see in the pictures on the right we've got different forms of testing that we can do as sport rehabbers to identify different physical characteristics in order to enhance performance in the future. Okay, so how does this fit into what you actually learn on the course at Salford? So on this slide, I've put on some key things which you will be able to do after your first year. So things that you'll learn to be able to do during year one. And the first is analyse any given movement and identify which muscles are working and how they're working. And that's really important because if someone comes to see you and they've injured themselves doing a particular movement, you need to be able to think in your mind which structures have been loaded during that movement, and that can help you to diagnose and then treat. Secondly, you will know how to use specialised equipment to measure athletic qualities such as acceleration, velocity, power output and jump height. One example of this is using timing gates, which you can see in the picture on the top right. We've also got plenty of different force plates, jump mats, things like that, loads of different bits of equipment that you will learn how to use, and that'll help you when you're out in the field later on. You will learn how to analyse the biomechanics of different exercises in the gym to make decisions on which variations you're going to use and what's appropriate for different patients that you have. You will describe the effects of forces on the body and how this might influence injury risk and how tissues adapt to different loads. So how does cartilage adapt to load versus how muscles adapt to load, things like that. And then finally, identify potential flaws in movement strategies which might lead to injury. So this isn't an exclusive list, you will learn much more than that, but just to give you an idea of some of the things that you'll be able to do in just over a year's time. And this is one of the things that I mean by using biomechanics to influence exercise prescription. So on the left you've got what we call a conventional deadlift, on the right we've got what we call a hex bar deadlift. So depending on which patient you've got and their injury history and their limb lengths and things like that, you will learn how to decide which one of those is more appropriate for that patient. So it's not only learning the sort of technical models and how to perform exercises well and coach them well, it's also learning about the biomechanics that underpin those, and off the back of that, what's going to be safe for a particular patient. Okay, so then in year 2, we look to build on what you've done in year 1. And again, this isn't an exclusive list. These are just some of the key things that you will look at. And the first is conducting proper movement assessments to identify strategies, movement strategies that is, that might lead to injury. So you can see in the picture on the right, that's one of our current second year students performing an overhead squat. And she's got some fellow students there assessing her movement and sort of trying to identify if there are any strategies there that might need optimizing to help her with performance and to decrease injury risk. Once you know how to do that, you'll then be able to conduct further assessments to identify why your patient is using that certain movement strategy, and then prescribe an exercise program to improve this. So you actually learn, obviously, how to assess, but then also what you're going to do about that to help performance and to reduce injury risk. We also look at analysing the mechanics of running and sprinting and changing direction to identify potential risk for injury and again ways to increase performance. And then we look at prescribing Olympic lifting exercises and other power-based exercises to meet specific athletic goals. So how do the biomechanics of something like a medicine ball throw compare to the clean and jerk, and why would you choose one over the other to meet that goal, for example? And then finally, using biomechanical assessments to help inform return to play decisions. So we actually start talking then about, well, how do you make that decision of whether or not your athlete or patient is ready to return to normal activities, return to play. And we can use biomechanical assessments to actually help influence that decision. So this is one example of analysing change of direction technique. So in second year, we'll look at this strategies such as the two that you can see on the screen, and we'll look at, well, actually, which might be better for performance in different situations, and what kind of structures might you be likely to injure, depending on whether you use the top strategy or the bottom strategy. So you will be able to, in a couple of years' time, look at those pictures and straight away be able to pick out potential injury risks to which structures and actually which might be better for performance in which different situations. So hopefully this has given you a little bit of an insight into what the sort of biomechanics element of the course involves. Obviously I've tried not to use too many complex terms because even though you'll pick them up very quickly in semester 1 from September, I don't want to confuse you too much at this stage. But I hope you enjoy the other presentations and I really look forward to seeing you in September.